Okay. Good afternoon, everyone. On behalf of the Wellness Advocacy Committee, I would like to welcome you to our third seminar of the 2021-2022 year. My name is Linda Blair, and I chair the Wellness Advocacy Committee. I hope that you had a chance to look at our list of planned seminars that were listed in KIT. Our next presentation is on Tuesday, November the 2nd by Trip Merchant, entitled Travel More, Save More. To register, be sure to contact the RTAM office either by email or phone. The RTAM website is undergoing updates, so if information is hard to access there, please contact the office directly. Today, I'm welcoming Heart and Stroke, as they were canceled way back when COVID first broke out and restricted our in-person gatherings. We were able to access Zoom as our platform for online presentations. So now, Jennifer, without further ado, I'll turn it over to you. Welcome.
Great. Thank you very much, Linda, and hi, everyone. My name is Jennifer. I'm a specialist, health policy and engagement out of our Alberta office for Heart and Stroke, but happy to be speaking to you all in Manitoba. So I'm going to go ahead and share my screen. And while I present, just because I've got my speaking notes and my slides here, I won't be able to see everyone. So just please feel free to stop me if you have questions, but otherwise we'll take questions at the end. Okay. Okay. So can you see my slide presented?
Yes.
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 Okay. All right. Well, let us jump right in then. So at Heart and Stroke, we know that knowledge is key to not only recognizing a medical emergency, but also to taking critical steps to save a life. This presentation will provide information on signs of heart attack, cardiac arrest, and stroke, and what to do in an emergency, an overview of risk factors, and what Heart and Stroke is doing to help beat heart disease and stroke so that fewer Canadians miss out on life. Most commonly, a heart attack happens when blood flow through one or more of the coronary arteries is blocked. This stops oxygen from reaching parts of the heart. If the blood flow isn't restored quickly, that section of the heart begins to die. Depending on how long the blood supply is cut off, the damage can be mild, severe, or cause lifelong problems. In some cases, a heart attack can be fatal. The most common cause of blocked blood flow is narrowing and hardening of the arteries, known as atherosclerosis. Heart attacks can also be caused by a coronary artery spasm, which is a temporary tightening of a coronary artery that can stop blood flow. The signs of heart attack can vary and may be different for men and women. They include chest discomfort. This can be felt as pressure, squeezing, fullness or pain, burning, or heaviness. Sweating, upper body discomfort. This can be felt in the neck, jaw, shoulder, arms, and or back. Nausea, shortness of breath, and lightheadedness. It's important to remember that the symptoms may not always be sudden or severe. Although the most common symptom is chest discomfort, some people do not experience any chest discomfort, and others only have mild discomfort or chest pain. And some people only experience one symptom, while other people may have a combination of symptoms. If you experience any of these signs of heart attack, call 911 or your local emergency number immediately, rest, and wait for help. And just a side note, we do have nausea stated here, but we have recently been contacted by someone located in Alberta who experienced what they termed their symptom as indigestion. And so I've just started to include that in my presentations as well. Not sometimes, some may feel that nausea and indigestion are interchangeable terms. Other times indigestion means something else. And so just wanted to make that clear as well. And really to focus in on the idea that if you feel unwell and you've got some of these symptoms, maybe you don't have any of these symptoms in particular, but anytime that voice in your head or your gut is telling you this isn't right, it's always a good idea to call 911 or to seek emergency medical help.
Jennifer, it's Pat here. If I could just interject, I am so happy to see that you included arms, because I actually experienced a heart attack like a year ago in July, and this is the key thing that I'm mentioning. When the nurses came in to check on me, And even when an intern doctor came to check on me, they both said, "How is your chest pain now?" And when I responded saying, "I never had a chest pain," they looked at me and they said, "Well, everybody that has a heart attack has a chest pain." And I went, "Well, I guess I'm the exception. My pain was in the arm." And I wish that people would know that, because it is clearly a signal. And ironically, just a few days later on Dr. Oz, he was interviewing 6 younger women who had heart attacks, and 3 of the 6 had arm pains as opposed to chest pains.
Huh. Yeah. Thank you for that comment, Pat. That makes a lot of sense. That's what we're hearing. That's what we hear from people with lived experience who we speak to and work with on the regular. And especially for women, we want to make sure that women pay attention to those signs, because they are often, or in the past, they have, it's been known and recognized, and that's kind of my next slide here, that women can have their symptoms dismissed as indigestion, as stress, as what have you. So if we want to make sure everyone's aware of the variety of signs that can result from a heart attack, and to know that men and women need to feel empowered to advocate for themselves. And if you go to emergency and seek help, to try and stick it out and stay there until you get that help. And for our part as well at Heart and Stroke, we are consistently putting out information for professionals as well, so that they become more aware of these variety of signs. Thank you for that comment. Basically, signs for men and women are fairly similar, but as we were just talking about, women don't always experience chest pain or discomfort. In fact, signs that women may experience more often are dizziness, lightheadedness or fainting, upper back pressure, extreme fatigue, pressure or pain in the lower chest or upper abdomen, and of course that arm pain that Pat mentioned. And our heart attack survivor, Carolyn, we featured her quote here, and it's really important to note that women need to know that they can have a heart attack and continue to walk, talk, and work. It's not always the traditional Hollywood heart attack that's shown in TV and film, where a person clutches their chest or their left arm and collapses. Often this will happen, and people will push through it, and they find out later that they have a heart attack. So again, if you've had those signs, those symptoms, and something doesn't feel right, it's always a good idea to seek medical care. Okay, so we've learned that a heart attack is when blood flow to the heart is blocked. A cardiac arrest is when the heart malfunctions and suddenly stops beating. During a cardiac arrest, the normal electrical activity controlling the rhythmic contraction and relaxation of heart muscle cells becomes chaotic and disorganized, leading to the heart to shake or quiver like jello rather than pumping effectively. Most cardiac arrests are caused by arrhythmias, which are abnormal heart rhythms, that may not be diagnosed ahead of time. Other causes include general heart disease, a heart attack that can progress to cardiac arrest, and external factors like electrocution, drowning, choking, trauma, or respiratory distress.
Sir, I have a question for you. Sorry about that. Addressed to your audience. I'm having difficulty hearing you right now. Could you? Is anybody else having difficulty with their sound?
A bit, yes.
Yes.
Yes. Okay.
Yes.
1 second here. I will see if I can plug this in.
That's okay. We have a lot of people joining right now. It's two joined late. So.
No problem. That. Can you hear me now?
That's better.
Better? Okay. Excellent. Great. Thank you for that flag. Okay, we will continue here. So an easy way to remember the difference in heart attack and cardiac arrest is to think of the heart like a house. A heart attack is a plumbing problem, like blocked pipes, and sudden cardiac arrest is an electrical problem, like the power has gone out. Both a heart attack and cardiac arrest need immediate medical attention, but a heart attack does not need CPR. A heart attack can progress to become a cardiac arrest, at which point CPR is required. The signs of cardiac arrest are: if a person suddenly collapses, they're unresponsive to touch or sound, and they are not breathing, or they're making a gasping sound. When the heart stops beating, blood is no longer getting to the brain, heart, and vital organs, and death can occur within minutes. If you witness the signs of cardiac arrest, you can save a life using your phone and your hands while still taking precautions against COVID-19. The steps to public hands-only CPR are: phone 911 and shout for an automated external defibrillator or an AED. If no one is around, call 911 on your mobile and use speakerphone. You can lay a cloth, towel, or clothing over the mouth and nose of the person to help prevent any potential spread of the virus. Push hard and fast in the center of the chest to the beat of the Bee Gees song Stayin' Alive, or about 100 beats per minute. Don't stop until help arrives or the person begins to respond. And use an AED if available. Excuse me, they are simple and safe to use. Turn it on and just follow the voice instructions. Don't be afraid of doing it wrong. Doing CPR, even if it's not perfect, gives the victim the best chance. In fact, survival rates double when immediate action is taken. You can't hurt, you can only help. So now that we've gone through a heart attack and cardiac arrest, let's look at a stroke. Stroke is a medical emergency that can happen to anyone at any age, from newborns to the elderly, and the incidence of stroke is high, with a stroke occurring once about every 9 minutes in Canada. A stroke is what happens when blood stops flowing to any part of your brain, damaging brain cells. The effects of a stroke depend on the type of stroke, the part of the brain that was damaged, and the amount of damage done. An ischemic stroke is caused by a blockage or clot in a blood vessel in your brain. The blockage can be caused when a substance called plaque builds up on the inside wall of an artery. Clots may form directly in the vessel in the brain or may form elsewhere in the body and get stuck in a narrowed vessel in the brain. You may have heard of a TIA, or transient ischemic attack. This is caused by a small clot that briefly blocks an artery. It's also called a mini stroke or a warning stroke. The TIA symptoms usually last less than an hour and may only last a few minutes, but it's an important warning. People who've experienced a TIA are 5 times more likely to have a stroke than those who have not, unless they're treated. And the other type of stroke is hemorrhagic stroke. This is caused when an artery in the brain breaks open. The interrupted blood flow causes damage to your brain. High blood pressure weakens arteries over time and is a major cause of hemorrhagic stroke. You may have heard of the term aneurysm. This occurs when a blood vessel has a weakened area that bulges or balloons out. This part of the blood vessel is weaker and prone to bursting, and when an aneurysm in the brain bursts, this is a hemorrhagic stroke. When a stroke happens, it's important to get medical help as quickly as possible. The first step is being able to recognize the signs of a stroke in yourself and in others. The easiest way to remember the most common signs of stroke is by remembering the acronym FAST. FAST stands for the following. F is for face. Is it drooping or falling on one side? A is for arms. Can both arms be raised overhead or does one drift downward? S is for speech. Is it slurred, jumbled, or nonsensical? And T is for time. If you or someone you know is exhibiting any of these symptoms, it's time to call 911. So again, that's face, arms, speech, time, fast. And you can even run those tests on yourself. If you're feeling sort of out of sorts, if you can get in front of a mirror, you can check your own face to see. You can put your arms in the air and see if one is drifting downward. And it's a great quick test for those around you as well. So these are the most common signs, but they're not the only ones. Additional signs of stroke can include vision changes, like blurred or double vision, sudden severe headache, usually accompanied by some of the other signs, numbness, usually on one side of the body, and problems with balance. Not everyone will experience all of the warning signs. However, if you or someone with you is experiencing any of these signs of stroke, it is vital that you call 911. And do not drive yourself to hospital. An ambulance will get you to the best hospital for stroke care in your region, and it may not be the closest hospital to you. EMS can diagnose when they see you or en route, and will be able to take you to a hospital with acute stroke care services. And what happens in the first few hours after stroke onset is critical. The faster the signs of stroke are recognized and the person experiencing stroke gets emergency help, the better their chances of survival and good recovery. So let's move on to risk factors. 9 in 10 Canadians have at least one risk factor for heart disease and stroke. The more risk factors you have, the greater your risk. Some risk factors can be controlled and others cannot. It's important to know which risk factors you have so that you can have ongoing conversations with your healthcare team about how to best manage your overall health. So first, let's talk about risk factors you cannot control. These include things like your age, your family and medical history, your particular heritage, and your personal circumstances, as in whether you have access to clean water and health services. Next, there are medical conditions that can increase the risk of heart disease and stroke, such as high blood pressure, high cholesterol, diabetes, and atrial fibrillation. These can be managed with medication and treatment, but are not always able to be eliminated. And finally, there are risk factors for heart disease and stroke that you can control. These include diet, physical activity, weight, whether or not you smoke, the level of stress you regularly experience, and whether or not you use excessive alcohol and or recreational drugs. The good news is that almost 80% of premature heart disease and stroke can be prevented by adopting healthy lifestyle habits and behaviors. Small, healthy changes in your daily routine can decrease your risk, and your healthcare provider can help you figure out what risk factors you should focus on first and help you set goals that you can reach. Our advice is not to try to change yourself overnight, but instead to start with goals that are relatively easy and to build on your successes. So now we'll go over a few fairly easy ways to adopt these healthy living choices and provide some advice. So a healthy diet. Eating a healthy, balanced diet is one of the most important things you can do to protect your health. A healthy diet can help lower your risk of heart disease and stroke by improving your cholesterol levels, reducing your blood pressure, helping you manage your body weight, and controlling your blood sugar. Canada's Food Guide recommends eating a variety of healthy foods each day. First up, eat lots of vegetables and fruit. This is one of the most important diet habits. Vegetables and fruit are packed with nutrients and help you maintain a healthy weight by keeping you full longer. If you can, fill half your plate with vegetables and fruit at every meal and snack. Choose whole grain foods. Whole grain foods are prepared using the entire grain. They have fiber, protein, and B vitamins to help you stay healthy and full longer. Choose whole grain options instead of processed or refined grains like white pasta and bread. Eat protein foods. Protein helps build and maintain bones, muscles, and skin. Along with food items like legumes, seeds, fish, and meat, dairy products are a great source of protein. Choose lower fat, unflavored options when available. Limit your highly and ultra-processed foods. Highly processed foods, often called ultra-processed, are foods that are changed from their original food source and have many added ingredients. During processing, often important nutrients, such as vitamins, minerals, and fiber, are removed, while salt and sugar are added. Some examples of processed food include fast foods, deli meats, cookies, white rice, and white bread. So really everything that we all enjoy. But we should look at making those snacks or the exceptions rather than the rules for what we're putting in our bodies. And finally, make water your drink of choice. Water supports health and promotes hydration without adding calories to the diet. When safe drinking water is not available, you can try to quench your thirst with coffee, tea, unsweetened lower fat milk, and previously boiled water. It's always a good idea to add physical activity to your life, regardless of your age. Physical activity can dramatically lower your risk of heart disease and stroke, help prevent and control risk factors such as high blood pressure, high cholesterol, and obesity, reduce stress levels, increase energy, improve sleep, and improve digestion. You may see benefits within the first week of regular activity. Heart and Stroke recommends adults should accumulate at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week in bouts of 10 minutes or more. The activity doesn't have to be nonstop, such as an aerobics class. You can do 10 minutes or more at a time throughout the day to reach your daily total. If you're short on time, remember that any physical activity is better than none. However, the more active you are, the greater the health benefits. Try to make physical activity a part of every day. You can try biking to work, taking a physical activity break at lunchtime, or going for an after-dinner stroll. Choose activities you enjoy, and that way you're more likely to stick with it. But if you haven't been physically active recently, we always recommend that you chat with your healthcare provider first before beginning an exercise or an activity routine. And smoking is a leading risk factor for disability and premature death in Canada. Quitting smoking has huge health benefits for you as well as the people around you. Smoking contributes to the buildup of plaque in your arteries, increases the risk of blood clots, reduces the oxygen in your blood, and makes your heart work harder. In fact, smokers are 2 times more likely to have a heart attack or stroke and are 2 times more likely to die from them. Good news is that quitting smoking immediately reduces your risk of heart attack and stroke. As soon as you quit, your body starts to recover. Within 48 hours of quitting, your chances of having a heart attack start to go down, and your sense of smell and taste begin to improve. myquit.ca and smokefree.gov both offer personalized quit plans that can help deal with the emotional and physical aspects of quitting. Some tips to help go smoke-free can include asking for help from family, friends, and coworkers, setting a quit date, having a plan for the challenges you'll face while quitting, understanding your triggers and being prepared to manage or avoid them, and making your home and car tobacco-free zones. Backed by dedicated donors and volunteers, Heart and Stroke's commitment to research has been unwavering for more than 60 years. From the first successful open heart surgery in Canada to the discovery of the gene responsible for heart arrhythmias, our researchers have led life-saving advances for heart conditions, stroke, and related dementia. With $21.8 million invested in 2020, Heart and Stroke is one of the leading forces supporting Canadian research in heart and brain health. This investment, made possible by Heart and Stroke donors, supports best-in-class researchers across the country. These innovative studies will set the stage for faster diagnosis, better treatments, and improved quality of life for people living with heart and brain conditions, both in Canada and around the world. As a quick example of one of our funded researchers, let's look at Dr. Guillaume Perret, Professor of Pathology and Molecular Medicine at McMaster University Medical Centre in Hamilton, Ontario. Dr. Perret is working to beat early heart attacks by identifying genetic risk factors. His team is the first to propose that the risk of heart attack is not due to a single mutation, as people used to think, but rather to what is called polygenic risk, which is the combination of hundreds or thousands of weaker variants. This means none of these genetic factors alone would cause a heart attack at a young age, but when a lot of them appear together, the risk is significant. They've tested this hypothesis and showed that about 20% of their patients with very early risk had a very high polygenic risk. In many cases, it was their only risk factor that could be identified. This research, supported by Heart and Stroke donors, was selected by the American Heart Association as one of the top 10 advances worldwide in cardiovascular research in 2018. Using cutting-edge data analysis, Dr. Perret and his team have discovered thousands of relatively common genetic variants to include in their risk score. His next goal is to find a way to integrate these with rarer genetic mutations that are known to cause disease in the people who carry them. It may take 10 years or more to get there, but he is determined. It's entirely possible to think of a future where a blood draw is taken, and by combining genetic information plus blood biomarkers, a very precise prediction of someone's risk of having a heart attack or stroke could be made. With your support, our research leads the fight against heart disease and stroke. Our areas of focus include equity in women's health. Women are not small men. Their hearts and brains are different, yet 2/3 of heart and stroke research is still based on men. We are working hard to close the research gap so more women are diagnosed early, treated properly, and saved. The heart-brain connection. Your heart and brain are strongly linked. When something goes wrong with one, the other is affected. So heart disease or stroke can lead to dementia. We must investigate this connection to empower the healthcare system to treat the whole person, not just conditions in isolation, and keep them healthier longer. And rehabilitation, recovery, and optimal health. Half of all Canadians have experienced or witnessed a painstaking fight back following a heart attack or stroke. Regaining function and quality of life can take years. We must help people in Canada recover more fully and get back to their best health possible faster. And as Donna, our stroke survivor, says, research is the reason I am alive today. And for myself, I wanted to share with you all that I'm also a person with lived experience. I have congenital heart disease and I was born with aortic stenosis. And 5 years ago, I had to have open heart surgery to replace my aortic valve. And research is the reason that I am alive today as well. Like I said earlier, Heart and Stroke contributed to the learning around the first successful open heart surgery in Canada and has contributed to many advances in heart health and in brain health that help people like me survive surgeries and live longer, healthier lives afterwards. So Donna and myself believe truly in Heart and Stroke's purpose for funding research and for helping with rehabilitation recovery and supporting people with lived experience. So that was a whole lot of information, and you might be wondering what you can do to help. Well, heart disease, stroke, and related conditions take 1 Canadian life every 5 minutes. You can make the difference between life and death by knowing your own risk factors and making healthy living choices every day. Remember the signs of heart attack, cardiac arrest, and stroke. As a brief reminder, a heart attack can present as chest discomfort or pain, upper body discomfort, sweating, nausea, lightheadedness, or shortness of breath. A cardiac arrest is suspected when someone collapses, is unresponsive to touch or sound, and they're making gasping noises or are not breathing. And the most common signs of stroke can be remembered using FAST: face, arms, speech, time. Remember that if you or someone around you shows signs of heart attack, cardiac arrest, or stroke, the first and most important thing you should do is call 911 or your local emergency number immediately. If you're witnessing the signs of cardiac arrest, begin hands-only CPR steps to save that person's life. If you're witnessing the signs of heart attack or stroke, help the person to rest and wait for help to arrive. And finally, you can also take steps to support heart and stroke. Your support helps champion critical research, forge successful partnerships, create healthier environments, trigger systems change, fund critical initiatives, and help people with lived experience like me to live long and healthy lives. You can visit www.heartandstroke.ca to learn more and to join us in our mission to promote health, save lives, and transform recovery. Thank you very much. That's the end of my presentation. So I can stop sharing and take any questions you may have. Oops, don't new share, cancel share.
Very informative, Jennifer. My understanding is that they're doing more research on women now. Do you have any idea how many women compared to men present with a heart attack or stroke?
Numbers for men versus women who present with heart attack or stroke, I don't have that information offhand, but I can certainly get that information and send it to Linda to share with the group.
Yeah, I just wondered if there was more women now that they're doing more research on the women. But,
like exact numbers would vary across the country depending on the province and the population. I think what they are finding is that the real issue and the reason why it's one of Heart and Stroke's priorities is that research is not done on women, even though there are larger numbers. So the exact amounts, I don't know how many women versus men present, but I do know that in the clinical and the biomedical research, not enough was being done to research both sexes properly.
Mm-hmm. So do you think we're being missed as women as far as heart attack and stroke goes?
That's what I'm reading.
Yeah,
that women are being misdiagnosed or missed. There's also considering, we also want to consider the fact that women are often the caretakers of a household and often are multitaskers and have various hats they have to wear in their lives, and so may not put themselves at the forefront of their needs. They may put their own these symptoms, they may shove them to the side unless they're so bad that they truly can't go on. A lot of women that experience heart attacks and stroke, but that can continue with their day for whatever reason, often won't even seek medical help because they've got too many other things going on. So we're also trying to encourage women to just to ask for help as soon as they feel like they need it.
Mm-hmm. Anyone else have some questions for Jennifer? Oh, Peggy?
Peggy, you're muted.
Not. You can't hear me?
Yes, you can. Yeah.
Okay, I'm sorry. Yeah, I have AFib and heart failure. And one of my questions to the doctor initially was, what shouldn't I do is there anything that in terms of activity and so forth that's harmful? Because I realize the 150 minutes a week and all that kind of thing. I've been a constant exerciser, so I understand that. But I also understand that I thought you could overdo it, and I never got an answer. I phoned the health links, and I never got an answer. They sort of hummed and hawed, and finally the doctor said, push yourself. So I believe that there should be, if there's less research being done for women, there should possibly be positively different steps to encourage the kind of exercise that would be helpful for heart failure and AFib.
Absolutely. That's a really great point, Peggy, and thank you for sharing that. And I'm sorry that you were unable to get a proper answer from your healthcare, the people that you contacted in healthcare. I didn't sense that you were really asking me, personally what you should do. So I won't comment on that. I'm not actually permitted to. But
know of anything that's happening in that area, and that's something we should be pushing for.
Absolutely. And the one thing I can share is that Heart and Stroke is working on, what's the way to say this? Convening other experts in the heart failure areas across Canada. So not only doctors and healthcare providers, but patient advocacy groups and pharmacare companies and cardiac rehab providers across Canada to come together and create basically best practices around how to handle heart failure from a physician perspective, as well as from the patient perspective. And so that is something that we've just started working on this year quite heavily. We have convened a working committee and an advisory committee as well. And so my hope is that within the next year, there should become more and more resources available for patients living with heart failure and for healthcare providers who are working with those patients. So that is something that we're actively working on. That would absolutely be part of the resources that we would be creating with this group. As I mentioned, cardiac rehab is a part of it. And I know that not every heart failure patient sees cardiac rehab after. It's often something that's if it's covered, it's often reserved for post-surgery. Not even everyone that has a heart attack will get sent over to cardiac rehab. So I think it's really great that we've got them at the table. And the hope is that the best practices will cover not only care in the hospital or with doctors, but across the spectrum of healthy living for anyone living with heart failure. Yeah.
I'd like to hone in on part of the comment that I made before. And I wonder, Jennifer, what power you have to forward that concern about people that are in the healthcare professions not knowing that women could be having a heart attack with a pain in their arm. I guess I was really appalled more at the intern, and he actually made me feel like a fool. And he said, well, then you probably didn't have a heart attack, because if you had a heart attack, you would have had a pain in your chest. And I said, well, in actual fact, I ended up in St. Boniface Hospital in Winnipeg, where I had 3 stents put in on one side of my heart and more stents put in on the other side. I'm quite sure that they would not have put stents in if I had not had a blockage. Then the stents were put in to support the blood flow. So basically, when the nurse said the exact same thing, I thought, what has happened? Well, as teachers, we were always involved in professional development to bring us up to speed on new changes, new rules, new methods, etc. And I would think that, supporting a person who had a heart attack, who did not have the main symptom, which is a chest pain, that they still were accurate. And in fact, I even went so far to say to the intern, I said, you need to come back and talk to me and interview me, because when you're going back to school, you need to be able to say, I found this woman who had a pain in her arm, plus a pain in my jaw. And I did eventually feel nauseous, but I was driving at the time, which sounds kind of bizarre, but I ended up getting home safely and ending up in the hospital, where the nurse there just took one look at me and said, you need to get, like, I passed the triage routine and was admitted immediately. So it's those kinds of isolated situations, which probably are not as isolated as we think. There are probably lots of people vis-a-vis the Dr. Oz show, and I don't usually watch Dr. Oz, but it happened to be, I was walking past the TV, and when he said that he interviewed these 6 women, and 3 of them had arms in their pain in their arms, sorry, which was obviously not a rarity.
Mhm.
So if you could pass that information along, that people need to be updated, that would be a great boost to women in society.
Absolutely, Pat. I totally agree. We do have connections with our institutions in each province, and with the health authorities within each province as well. So I know within Alberta, we have regular meetings with the Libin Institute out of Calgary and the Mazankowski Institute out of Edmonton and our Alberta Health Services. And so I know that our counterparts in Manitoba have similar relationships. But it's certainly worth highlighting again that it never hurts when we have these meetings to, bring this forward every so often, bring up these signs again, bring up these, our website links where they can easily go and print the posters and have them there for their students or their residents or whomever is working at the time. So it's a great reminder that, it seems like because I'm so involved in this sort of stuff that it seems like common sense. Of course, there's these different signs, but it never hurts to remind the people that we work with and who are becoming healthcare providers. As well.
It's thanks to the Heart and Stroke Foundation that I was aware of enough of the signs that I was able to add them together and react accordingly. Truth to tell, my father actually died from a heart attack when he was 51 years old. So genetically, my siblings and I know that we're on that checklist of, has there been a heart problem in your family? Well, that's pretty close. Mm-hmm. So I have been continually cognizant of watching for signs and not blowing them off and being, silly about them. Oh, this is not really anything. But mm-hmm. This was something, and I was pretty sure it was. Thanks to the Heart and Stroke Foundation, saying a pain in your jaw could be one sign.
Well, I'm so glad to hear that it was helpful for you, and I definitely take your point, and I'll be bringing it up to my Western colleagues as well, that we should remember that we can continue to bring this up to our contacts in the provinces as well.
Thank you so much.
You bet. I see someone has put a question. Do the ambulances in Alberta carry any special drugs to help those who suffer a stroke? Just curious. Thank you, Kel. So the ambulances don't usually carry the clot busting drug that would help a stroke. And the reason being, I mentioned the 2 types of strokes. So the brain bleed is one that does not require clot busting because it requires immediate surgery basically to help repair the tear and to stop the bleeding. The ischemic stroke, which is the clot, does require some sort of drug assistance, or they can also do a surgery sometimes where they can go in and actually manually remove the clot. However, a person needs to get to a hospital with the proper imaging technology to be able to know which type of a stroke they're having. So while an ambulance EMS can say, oh, this person, based on my training and my knowledge, is very clearly having a stroke, we're going to go straight to the main hospital in Calgary or in Winnipeg. They can do that, and they can ensure that they go right there instead of to a local health center. They should not be administering drugs without having that imaging done on the person, because giving a clot busting drug would almost be like taking aspirin when you're having a stroke. And if you're actually having a brain bleed stroke, the aspirin is going to cause you to bleed more. So that's the other thing. You didn't ask this, but I'll just say this as well. If you think that you're having a stroke, don't chew aspirin. Just call 911, have EMS come to you, because it's a 50-50 chance that you're having a stroke with a bleed that aspirin will make worse, or you're having a stroke from a clot, which aspirin could help with the clot, just like it can help when you're having a heart attack based off of having a clot in your heart. But you don't want to take that risk. It's better to call for help, get to the hospital as quickly as you can. They will do the imaging on you, and then they will determine what type of help that you need.
Because they used to say to take an aspirin all the time.
But not for
Yeah,
stroke.
right.
Okay.
Yeah, it wasn't, I think it's been confused recently because of heart and stroke, possibly even because of our brand, having heart and stroke in the brand. And we talk often about heart attack and heart disease and stroke.
Okay.
However, yeah, our instructions are to not take aspirin if you think you're having a stroke. If you think you're having a heart attack, you can still take, it's still recommended. Sorry, I shouldn't say recommended. If you do not have an allergy or a contradiction to taking aspirin, you can take you can chew 2 baby aspirin, which is 81 milligram, or 1 325 milligram aspirin. You can chew that. If you have a prescription for nitroglycerin, you can take that as well while you're waiting for the ambulance to arrive. However, I think that best case is call 911, speak to the dispatcher, and they can provide you advice based on, if you relay your symptoms, they can say, okay, if you've got these pills and you're able to, you can take them, and they'll note that in the call for EMS. But if you don't have that conversation, if you're not totally sure, don't take anything. Just wait for EMS to get there, and they can help.
Yeah, because I know a fellow that carries a little container on his keychain that's got an aspirin in it.
Yeah,
And
I carry some as well.
Oh, okay, so in his situation, he can do it, whereas we
Well,
shouldn't, or is that
I recommend talking to your doctor.
period?
Confirm with your doctor whether or not you are physically able to take aspirin in the event that you think you're having a heart attack. But I mean, no doctor should be telling you to take aspirin if you think you're having a stroke, just because of that potential to cause more bleeding in your brain. But yes, talk to your doctor, talk to your health provider about aspirin. And if they advise that that's something they would prescribe to you, then absolutely. And like I said, I carry 2 baby aspirins with me everywhere I go, just in case.
Yeah.
Yeah, Ken just pulled it.
So do we have some more questions? I saw some hands waving or that. Just wondered. Denise, did you have a question?
No.
Okay, just wondered. Yeah. So are there more men having heart attacks the traditional way, so to speak?
More men report that, anecdotally will report that they're having the left shoulder or arm pain and the chest pain. It does seem to be more often reported. Anecdotally as well, I've heard from other female women who have had heart attacks, who speak to heart and stroke. I've heard from them that, their husbands or their brothers, or adult men in their families that they've seen who have had heart attacks. It's the same sort of thing. It's that traditional sort of look and feel to it. And if they go into hospital, this is all anecdotally, of course, but when they go to hospital, it's reported that they are, they mention, oh, I think I'm having a bit of chest pain, and they're immediately taken through triage to this guy's having a heart attack. Whereas some of these women have reported their own stories of going to hospital and will say, I think I'm having a heart attack, like my heart's racing, but I'm feeling kind of nauseous, I'm sweating a lot, and they won't get immediately put through. Now, that's not all the time. It's not everywhere. There are lots of cases where doctors and nurses and residents and interns, like all spectrums of people working in hospitals, will recognize that a woman, what she's complaining of could be a heart attack, and do an amazing job helping that woman get help. So I don't want to paint this grim picture. The biggest thing that I ask people who I speak to take away from this is to be your own health advocate, to focus on putting yourself before, when you're having symptoms or you're just not feeling totally healthy or well. value yourself as much as you value your car and your house and your kids and your spouse. It's okay to put yourself first in those situations and go and get that help. The other thing is, you may have to insist upon it, but we do also live in a wonderful country where we don't have to consider, can I afford to go to the hospital?
Yeah.
Can I afford to seek emergency care? There are some costs, absolutely. But overall, I think that we've got a really great healthcare system, even with its flaws and its faults, that is there for us. And we have to be the ones to take advantage and to say, okay, I'm going to go use this system because I need help. It won't come to us. So yes, be your own advocate, value yourself, ask for help, and demand it if you need to.
Mhm. Yes. Well, I'm wondering if there is no more questions. Is there something you want to summarize now, Jennifer, before we sign off?
Oh, Peggy, did you have your hand up?
Oh, sorry.
I have a comment, and you do seem to have a little bit of time. So
Sure. Yeah.
I would really like to underline your last statement, because for some of us, it's not only insisting on getting care, it's insisting because of your age. I have had a doctor more than once say to me when I went for care, and well, whatever she gave me didn't work, or didn't work to my satisfaction. And her comment to me was, well, you've had a good life, haven't you?
Oh,
And I've had that happen to me. And I have been involved with gender issues a long time, and I don't like to be labeled that way, but we really do have to insist. Insist is a great word, not demand, but insist, because that's the minute they see your age on the chart, and that's right full in front of them, even if I've had 2 doctors retire on me. So they get somebody new and they see the number, and all of us are living longer than in this generation than any other generation. Like, the numbers are greater, but that still is in people's heads. That so to be involved with ageism and to be involved with gender issues is also a help for your health. And so I really liked what you had to say at the end there. And if there's anything we can do with that, and I think that's something we can do to help our health.
Great. Thank you, Peggy. I'm so offended on your behalf at that statement from, wow. And
You're alone in the office, and it seems silly to walk out and tell somebody, oh, you're just whining again, is sort of the comment. But
Jennifer, sorry, I missed this, but you might have someone, but I don't know if I missed this question or not, but someone put a question on the chat line. It says, I have a question. How much does our hereditary health history of heart and stroke play a role?
Thank you. Yes. Hereditary health history is important. So family history as well as personal medical history, it does play a role. However, how much depends on you and your particular makeup, your history. And so if you're curious about that for yourself, I would advise that you speak with your doctor or healthcare provider, just to find out how much of that background and history could be affecting your potential for heart disease and stroke.
out there.
Yeah, it must be.
Thank you for answering that question.
You bet, Gordon. And thank you to Meryl for asking it. Yeah, and so Linda, you had mentioned if there are no other questions, what I might want to say to wrap up would probably be that heart and stroke, I really believe in what Heart and Stroke does. I started out as a volunteer after I had my surgery, and then ended up becoming a staff member with the organization, just because I really wanted to share my experience with others and to put my working time towards helping others with this, because there was no way that I could go and become a nurse or a doctor. I cannot handle bodily fluids and scary situations. Those people are incredible.
Yes,
I can't do that.
yes.
Yeah. So I thought, if there's any way that I can give back to the community for the second chance at life that I have, that it would be to start working with an organization like Heart and Stroke. And I just want to say how grateful I am to have the time to come and talk to you all about, the signs of heart attack, signs of stroke, the ways that we can make healthy living choices. That's also important. And I think it's some of the most important stuff that we do alongside funding research. Heart and Stroke is the second leading funder of heart and stroke research in Canada after the federal government. So we play a huge part in funding researchers at multiple stages in their careers, to ensure that they continue to look into ways to not only help prevent heart disease and stroke, but to help people that have had an event or a diagnosis and to help them lead fuller lives post-event and diagnosis. And so, I just, I appreciate your time and your attention, and any support that you can provide to Heart and Stroke will be eternally grateful for. And I hope that you all got some good information out of this as well.
Thank you.
I don't want to rush anybody because I think we have another 10 minutes left if somebody does think of another question.
I thought it was 1:30 to 3:30.
Must be.
Mhm.
I'm not sure whether that was a question or. Okay, hearing no more questions then, I'd like to thank everybody for attending. I just want to remind you that there's an evaluation form that we as a committee very much appreciate you completing and putting your comments down. It helps us in our future planning. And I do hope once again that you are looking at our list of events for 2021, 2022, as they were listed in KIT and on the website. And again, if you have any problems accessing the website or that, you need to talk to the office or email the office, please do that as well. We have a fantastic staff that can look after everything there. Jennifer, thank you so much. This has been a long time coming kind of thing due to COVID and that, but I'm so glad we made it happen today. And I see Derek's on here, so I'll ask Derek if you just hang on after everybody leaves, please. And
Okay, thank you. Thank you very much.
thank you.
Thank you.
Thank you.
Take care.
Thank you.
Thank you,
Thank
Jennifer.
you. Thank you very much.
Good afternoon, Linda and Gordon. Jen, thanks so much for doing that. Appreciate your time today.
You bet. I didn't know you were attending, Derek.
Oh, I wasn't going to miss it. I had to jump out of another meeting, so I was a few minutes late. But yeah, I knew I was going to try and log in. And I apologize for this virtual background. I don't know how to turn it off now. This is in preparation for a future meeting here in a couple of days. But yeah, I'm sorry.
Oh, that's okay.
Hey, it looks
Well-
fluffy. It's okay.
Yeah.
I was gonna say it looks a little ominous for me. It's not normally my preferred energy, but we'll go with it.
Yeah. So Derek, are you a father yet?
Not yet. The little boys have not arrived as of yet, and that's okay. You know,
Yeah,
we're
yeah.
at